Hey there! Welcome to another lecture for the course Counseling 5480 Diagnosis and Treatment Planning. This is Dr. Luo. In this video, we're going to talk about anxiety disorders in the DSM-5. Without looking at your notes, would you like to guess about how many American adults experience anxiety disorders recently? 40 million adults. That's roughly 18% of the population, and that makes anxiety disorder the highest diagnosed mental health concern in the United States. What do you think about this? Do you think it's surprising? And how would you estimate the prevalence of anxiety disorders in 2020? If you have read the anxiety disorder chapter in the DSM-5, you would know there are a number of anxiety disorders, and they are highly comorbid with each other. What that means is that a client can be diagnosed with generalized anxiety and social anxiety as well. So people can have more than one anxiety disorder diagnosis at the same time. Anxiety disorders that are not treated in childhood or adolescence have been associated with other anxiety disorders, depression, and even substance-related issues in their adulthood. In general, there are more females diagnosed with anxiety disorders than male, with a ratio of 2 to 1. Like any other chapter, anxiety disorders were also arranged developmentally in the DSM-5. The ones in the beginning of the chapters, such as separation anxiety and selective mute, have an onset in early childhood. And then the anxiety disorders at the end or comes later in the chapter, such as panic disorder or agoraphobia, generalized anxiety disorders. They usually have a later onset, which means that people develop these disorders later in their adult life. Anxiety symptoms can be categorized into these three groups. Common physical symptoms include feeling tight in the chest, stomach discomfort, like feeling butterflies in the stomach, feeling dizzy, tense in the body, feeling restless, sweating excessively. The heart may feel like it's pounding, fluttering, or beating irregularly. People may have headaches, migraines, and also trouble breathing. People may say they can't catch their breath. People who are struggling with anxiety symptoms usually feel confused, like they don't know where these come from. They feel ashamed, especially when they're losing control in front of people they know. And of course, they're really, really scared and they're very worried. Are there any other feelings that you can think of? In addition to the physical and emotional response, when people are anxious, they may not be able to focus very well. And it's also very common for them to feel hypervigilant about their surroundings, about people around them. And they may also spend large energy and time to avoid the things that cause them to worry. It's not a good feeling. Now, let's take a look at the major disorders that have been captured in this chapter of DSM-5. Separation anxiety disorder refers to the situation where the individual feels anxious, extremely anxious, when their caregivers are separating from them. People with selective mutism are struggling to speak in situations. and there is not a medical reason for that mutism. And then there are specific phobia in this chapter, which refers to anxiety associated with specific objects like animal or blood or any other objects, um, or situations such as like airplanes or elevators. Then there's also social anxiety disorder or simply social phobia. People with this disorder have intense fear associated with one or more social situations. They are above and beyond just being an introvert or being shy. And I'm sure we all have heard about anxiety attack or nervous breakdown, right? So these are actually called panic attacks. Panic attacks itself is not a mental disorder. It's a condition that can happen and can comorbid with any other mental disorders throughout DSM-5. So we can always add panic attack as a specifier for any other mental disorder diagnosis. Only the repeated, recurrent, and unexpected panic attacks can meet the criteria of panic disorder. Agoraphobia refers to the type of fear of the two or more situations, and usually these are like public space or open space. And people who struggle with this disorder, they probably spend large of time and energy just trying to avoid of these public spaces. They may stay at home all day long and they may just refuse to go out at all. At last, we have generalized anxiety disorder. As it's indicated from its name, this disorder, we usually call it GAD, refers to excessive anxiety and worry in general. Like there is not this type of anxiety is not really associated to any objects, situations, or environments. It's just in general, this person is very easily to feel anxious in various situations across different settings. Separation anxiety disorder is commonly seen among children. The prevalence decreases from childhood through adolescence and adulthood. So in the previous DSMs, this disorder is one of the children disorders because of its prevalence among children. But in DSM-5, this disorder can also be given to adults. So what are the diagnostic criteria? They are listed on page 190. So I would recommend you to have your DSM-5 open so that you can follow along. Symptoms of individuals who suffer from separation anxiety disorder include that they get upset, like really, really upset when they have to separate from someone that's really important. It's usually their attachment figure. So for children, they are usually their parents, their other caregivers, and for adults, they're usually, well, first of all, they can also be their adult parents, but can also be their partners or their own children. Symptoms also include excessive worries about possible harms that can be done to their attachment figures, such as illness, injury, natural disasters, or the fear of losing the attachment figure. When they are separated from their attachment figure, they are also worried about the cause of separation, such as maybe they are maybe like my children are kidnapped, that's why they're not home yet, or maybe my parents are in an accident, maybe they become ill. Basically, when they're separated from their attachment figure, they're worried about something bad that has happened to their attachment figures. In addition to those symptoms, individuals also refuse to stay alone without the attachment figure. They may not sleep without that person, or they may have nightmares about the separation with that attachment figure. They may also have complaints of physical issues, like have a headache, have a stomach ache when they are separating or they're about to separate from their attachment figure. And so something about um, making a diagnosis is that you always need to pay attention to the duration of those symptoms. So for separation anxiety disorders, these symptoms, well, first of all, you need to have at least 3 of those symptoms that I just mentioned. Secondly, those fears and excessive worries need to last more than 4 weeks for children and adolescents, and the duration needs to be more than 6 months for adults in order for them to receive this diagnosis. In addition to that, the symptoms need to cause clinically significant distress. What that means is that these are out of proportion, and these distress have been severely impacted on a person's normal life and their functioning level. Like a child may not be able to stay in kindergarten, or a adolescent may not be able to concentrate in class. And for adults, they may not be able to work, right? And then the last criterion is that the situation is not better explained by another disorder. So this is the type of criterion that we call it differential diagnosis criterion. This is the part where the DSM is reminding you to differentiate separation anxiety disorder with other disorder. Usually you want to think of other anxiety disorders because they're similar in their symptoms. With separation anxiety disorder, there are a few things that I want to note. The first one is that, separation anxiety itself is kind of normal in early development, and sometimes it's even a good thing. According to DSM-5, periods of heightened separation anxiety from attachment figures are part of normal early development and may include the development of secure attachment relationships. In other words, when children are very young, you want them to kind of get worried when they can't see their parents, right? You don't want them to um, follow a stranger because that's kind of dangerous, right? But it doesn't mean that the younger a child is, the more easily for them to get this disorder. For example, a child who's a 3-year-old, they may have difficulty leaving their parents, but a child who's 3.5-year-old is in a different developmental stage called disequilibrium, and they may cry, whine, and have more difficulty separating from parents. So like the symptoms in 3.5-year-old are even more severe than the 3-year-old. So what's causing this special type of anxiety? Oh, like most of mental disorders, this one also has its own genetic foundations, its own like physical reasons. As far as environmental factors, a few things needs to be considered. The first one is trauma. Does this person or a child has any trauma, especially in their early childhood? Have they lost someone who's really close to them? Have they ever been in any kind of accident when they were very young? Second, we need to consider if there are any stressors in life. For example, it's very common for children to have heightened anxiety regarding school when they just move to a new neighborhood. And then the last one we really want to consider is, what is the role of the parents When the child exhibiting these symptoms, what do their parents do? Do they kind of feed in their children's anxiety by giving them even more attention whenever they cry? If that's the case, that can be a factor that's causing separation anxiety. I highly recommend you to pause the video for now and click the link at the bottom of this slide because I want you to watch an example of a child who's struggling with separation anxiety, and also how has the mother been dealing with the separation anxiety. I think it's a really fun video and it's kind of informative as well. If you have watched that video, you could see how the mother in the video had been feeding into her son's separation anxiety every time when the child cried, whenever she's about to leave home, she always just go there and then pick him up and start calming him down. She always attends to his anxiety. She also tries to explain why she has to leave, and none of those worked. Later on, she has changed her approach and she just become more assertive whenever she needs to leave, and she just told him that mommy's leaving and mommy will come back without too much explanation of why she's leaving. And also the rest of family members kind of just ignored his behaviors, ignored his anxiety, and just pretend that everything is still normal because everything is normal. And then gradually he is able to adjust to the situations when his mom is not there. From this video, we can see how important the family is, right? As far as the role in the treatment. So the first approach when we're working with who individuals who suffer from separation anxiety, the first thing is probably to educate the family members, to let them know what separation anxiety is and what are the ways that can help a child from stopping separation anxiety. Another approach is play therapy. In addition, CPRT, child parent relationship therapy, has also shown some effectiveness in treating child with separation anxiety disorder. Basically, they're training the parent to develop a safe attachment with their children. And then there's also an approach of exposure therapy, which has been used widely for anxiety disorders in general. What is your approach? Which one do you like the most? Next, let's talk about panic attack specifier and the panic disorder. What are the symptoms of panic attack? For those who have experienced panic attacks, they usually describe their feelings to be like as if they're about to die. They really freaked out. They usually report a pounding heart, sweating, shaking uncontrollably. They can't catch their breath, feel like they're choked. They feel the tightness in the chest or maybe even painful in the chest. And they feel nausea, they're about to throw up, or they don't feel very comfortable in their stomach. They may also feel dizzy. They're usually worried about passing out, especially in a public situation. For some people, they may even experience chills, feeling numb, or just feeling unreal. And then almost all of them will tell you that they feel like they're losing control. They're definitely losing control and they feel that as if they're dying. So it's a kind of terrifying feeling. And for a lot of people, when they're experiencing panic attacks, they don't know what that is. So they may call the ambulance and they may end up in the emergency room. And that's when they will be told that, hey, this is just an anxiety attack. There's really nothing wrong with your body, and you should see a counselor. The panic disorder has the following diagnostic criteria. Criterion A requires an individual to experience recurrent and unexpected panic attacks. And in order to be considered as a panic attack, that individual needs to have at least 4 of the symptoms on the previous slide. The second criteria requires the individual to experience either persistent concern or worry about the following panic attacks, or they are exhibiting some behaviors related to the attacks. Like, for example, people may stop going to public places, or they may stop going to the gym for exercise, or they may just stop going to any place that's new because they are worried that they don't know once they have a panic attack, where do they hide? Do they have a private place where they can just calm themselves down? Or just in general, they're still afraid of passing out in those places. And the duration of this kind of worry or the behavior need to be longer than 1 month, followed by at least one of the panic attacks. And then there are additional 2 criteria that I have not included on this slide. Basically, you just want to make sure that the symptoms that the individual is experiencing is not due to substance use or another medical condition. And you also want to differentiate panic disorder from other anxiety disorders. So, how is panic attack specifier different from panic disorder? If you still remember from the previous slides, the panic attacks for panic disorder are unexpected, which means that it can happen without a clear cause of the panic attack. And for the panic attack specifier, it includes both unexpected and expected panic attacks. For example, I have a client who has social anxiety, and she has already known, like, if she goes to a place surrounded by, or she is surrounded by strangers, she's probably gonna get a panic attack because she doesn't do well in social situations. And so her diagnosis could be social anxiety disorder, comma, with panic attacks. And remember, DSM-5 allows panic attack specifiers to be used for all anxiety disorder. So you can do generalized anxiety disorder, comma, with panic attacks, or post-traumatic stress disorder, comma, with panic attacks. Something we need to pay attention to is that the word anxiety attack is not a vocabulary used in DSM-5, although that's what usually people would refer to. Another difference is that in order for someone to get the panic disorder diagnosis, they have to have more than one unexpected full symptom panic attack, whereas panic attack specifier doesn't require that. Generalized anxiety disorder has 6 different criteria. Criterion A requires the individuals to have excessive anxiety and worry for at least 6 months across different settings. So they want you to make sure that the individuals have very high level of anxiety that has nothing to do with where they are or what they do. The individuals find it so hard to control the worry, and they're exhibiting at least 3 of the following symptoms. We have already reviewed all of these symptoms in the previous slides, so I don't want to spend more time on these. And then you want to make sure that the anxiety and worry and these symptoms has caused clinically significant distress. basically we want to make sure that the worry is out of proportion and it's severely impacting on the person's life. And we want to make sure that these symptoms are not caused by any substance or another medical condition. And finally, we want to make sure that we compare these symptoms with other possible disorders that also share similar symptoms to make sure that this GAD is the correct diagnosis. And sometimes, for people who are well adjusted to the environment, they may not display these symptoms. Instead, they try to avoid situations or they try to avoid things to cause them to feel worried, which is why it's very important for us to ask the good questions in order to uncover the real symptoms. And those avoidance can be very outstanding. Like, for example, I had seen a female client who has stopped going to school and taking classes in person. Right now, she just take all the classes online, and sometimes she can't take the one that she wanted because those courses are only offered in person. If I don't ask any more questions, I will just forever be confused about her behavior. So I asked her to tell me more about that. And then she told me, well, it's really because that she's very anxious whenever she speak in public. So she just tried to avoid any kind of in-person situation, if that makes sense. And again, if an individual who has meet the full criteria of GAD but also experience panic attacks, you can always add that panic attack specifier after the diagnosis of generalized anxiety disorder. Starting March of 2020, I have noticed an increasing number of clients who are experiencing moderate to severe levels of anxiety. And these people include those who had a history of anxiety disorders in the past, or those who had panic attacks in the past. And the pandemic just heightened their symptoms. And there are also people who have never had any panic attacks but start having those panic attacks because they're really worried about the virus. Out of my curiosity, I just looked this thing up. And then I found something really interesting, something called coronaphobia. Now, this is not a diagnosis. I repeat, this is not a mental diagnosis for now. But since this is so fascinating, and it's also time sensitive, I just want to go ahead and share it with you. So coronaphobia, according to Arora et al. In a 2020 article, has been defined as an excessive triggered response of fear of contracting the virus causing COVID-19, leading to accompanied excessive concern over physiological symptoms, significant stress about personal and occupational loss. I'm sure we can all identify with that. Increased reassurance and safety seeking behaviors, and avoidance of public areas and situations causing marked impairment in daily life functioning. And again, I'm sure, like, if not all, most, if not all of us are experiencing some level of anxiety related to coronavirus, but only those who have experienced significant stress um, of the virus and who have experienced like um, maybe impairment in their functioning level can be um, quote unquote diagnosed with this coronaphobia. I also find the mechanism of coronaphobia to be very fascinating. So, physiologically, the fight or flight response of fear is triggered, or being exposed to the antecedent event. And that event could be knowing someone who's a acquaintance or a friend or family member has contracted the virus, or maybe watching a piece of news about the coronavirus, or maybe receiving a positive result of coronavirus. This worry can cause symptoms such as anxiety, like palpitations, tremors, um, difficulty in breathing, dizziness, change in appetite, and sleep. So thinking about 2020 to right now, have you experienced any of these symptoms? And cognitively, the fear of this virus would involve preoccupation with threat-provoking cognitions. And these cognitions or simply thoughts um, are like, for example, people may think I'll die if I contract the virus, or I will not be able to go to my job and will be unemployed, or my family is under danger and they may die. And from a framework of CBT, we know these kind of thoughts can further trigger some emotional responses like feeling really sad, guilty, or even angry of why we're into this, why this is still not over. Behavioral wise, individuals engage in avoidance behaviors, just like anyone who is experiencing anxiety would do. So there's a marked fear of using public transportation, touching any surface, being at open places or at enclosed places, attending any public gatherings, and standing in queue. Because we're all trying to keep the distance from each other, right? People also avoid situations like meeting new people or overindulges into health-related safety behaviors like constantly washing hands. And if you're like me, I always have an alcohol spray that I use it on everything. There are also behaviors of called reassurance behaviors, including like people are constantly checking their body vitals, confirming that they don't have the virus, they they are not feeling sick, or maybe self-medicating, or they're just always checking sanitation, and all of these behaviors perpetuates the fear, which leads to phobia. And even though this fear is realistic, even though there are valid rationale behind the fear, it still can be disturbing for someone's overall quality of our lives. What do you think of this coronaphobia? Do you think it should be a diagnosis? Does it sound like a diagnosis? Why or why not? And we can discuss this in our class meeting. Now that we learned about different anxiety disorders, how do we assess the level of anxiety? There are a few options for you. You can use some of the comprehensive assessments, which evaluating various mental illness symptoms, including anxiety. So such as ASR, which is short for Adult Self-Report, and there's also DASS-21, which is short for the Depression, Anxiety, and Stress Scale, 21 items, or CBCL, which is Child Behavior Checklist. And then you can also choose scales that are specifically targeted on people who struggle with anxiety. So you can use Beck Anxiety Inventory, which is good for people who are 17 years old and over. And then you can also have General Anxiety Disorder 7. That is good for 13 years and over. I have used a General Anxiety Disorder 7 because there are only 7 items, and I think it's very handy. And then there's also anxiety scale specifically designed for children. An example is Revised Child's Manifest Anxiety Scale, second edition. If you're not a big assessment person, you can always use the scaling question, right? On a scale of 1 to 10, with 1 being no anxiety at all, with 10 being almost always feeling on edge. Where are you? Over the time, you can ask the same scaling question again to see how is the client moving between scores. And that's also a good way to monitor client progress. As far as the anxiety disorder treatments, there are so many options. It probably has something to do with the fact that anxiety disorder is the most common disorder in the 21st century. You can choose from CBT, behavioral treatments, mindfulness, ACT, group therapy, family therapy, and there are also lots of medications that are for anxiety disorder, like including Xanax, right, Valium, and Buspar. And most often, the psychiatrist would tell the client when they prescribe the medications to the client that the medication is not a cure, right? They still need to go through counseling. They only get prescribed medication so that they are calm enough to go to counseling, that they are able to manage their symptoms so that they can learn some coping skills. And eventually, the hope is that they can cope with their anxiety without medication. However, not many people are thinking that way, or not not all the people are thinking that way. So that's when we really need to take the role of educating our clients about the effect of medications and how would counseling help with their symptoms. There are also special techniques for anxiety disorder, including progressive muscle relaxation, heart rate variability, biofeedback, neurofeedback, and our good old child-centered play therapy. You can choose the therapy that fits in your theoretical orientation. But what I like to share with you is that, in my clinical practice, if I have client who has some anxiety symptoms and also have some other issues, I usually prioritize the treatment of their anxiety symptoms because I find it really helpful to encourage them to move forward. If they're constantly feeling on edge, how are they able to implement what they learned from counseling session to their life? Do you have any experience with anxiety treatment? What have you learned from it? What is your way of coping with anxiety? On this next slide, I have prepared a fictional case study for you to practice your diagnostic skills. So take some time and read through this practice case. Highlight the sentences that indicate you their symptoms, and then we can discuss about this case study in class. All right, you have reached the end of this lecture. I hope you find this information helpful. And as always, please shoot me an email if you have any questions. Schedule a meeting with me if you want to discuss with me more about this stuff. Thank you for watching. I'll see you in class.